and then on to college, where he became an addict. He could be your child or the kid next door.
Tori Brinkman has always been a survivor, born 15 weeks early, a tiny pound and a half, and that was just the beginning of her struggle. For the first 10 years of her life, she lived with a mother addicted to heroin. We're back now with an NBC News investigation with our partners at Reuters into an especially disturbing side of America's growing heroin epidemic. The CDC says the number of babies born in withdrawal, a dependency inherited from a mother battling addiction, has risen fivefold over the last dozen years.
You and I are going on a difficult journey. The statistics alone are alarming. The number of heroin users has nearly doubled in just the past 3 years. Even more surprising may be the face of the new addicts. Tonight, you're going to meet kids from families you never thought.
Story from our senior legal and investigative correspondent.
Substance abuse or drug addiction is one of the major problems faced here in the Philippines. It is saddening to know how majority of the drug users are young people. According to the Dangerous Drugs Board in 2016, that 3.7 million people in the Philippines are experiencing drug abuse, and 65% of them are minors.
Some of these people are attracted to using prohibited drugs because they are trying to seek entertainment. Some of them are influenced by the people around them, and some are just curious. However, there are people who use drugs because of personal problems, specifically to escape from their traumatic experiences, bad relationships, and different physical and emotional abuses.
When we take a look at a larger scale, one of the worldwide pressing concerns of today includes the growing cases of mental health illnesses, especially depression. Adolescent depression is increasing at an alarming rate. Recent surveys indicate that as many as 1 in 5 teens are suffering from clinical depression.
There are a lot of problems faced by the young people of today. This may include pressure from family, academics, and peers. This unsettling time is accompanied by physical, emotional, psychological, and social changes which oftentimes lead to disappointments and too much stress that damages one's mental health. But what could be the scientific explanation and solution for all of these?
Good morning, everyone. My name is Kathryn Hipolito. I'm a licensed psychologist. I'm one of the faculty members of University of Santo Tomas. I'm doing my clinical practice in UST Hospital in Natasha Goulburn Foundation as their consultant, and I'm also an active volunteer of the Psychotrauma Clinic. Neuroscience is the scientific study of the nervous system, its structure, and its function. It studies how the nervous system affects one's emotions, cognitions, and behaviors. So why is it important for us to study this? So minsan kasi may mga behavior tayo na ginagawa na sinasabi lang na it's because of the person has bad behavior. Or for example, if we're talking about drugs, sabi ng iba, it's a lack of will. Pasaway lang yan, kaya nagda-drugs yan. But neuroscience tells us that substance abuse is actually a chronic brain disease. Again, it's a chronic brain disease, not just a lack of will, which is characterized by excessive urge to use drugs and inability to stop using it regardless of its consequences. So, inability to stop using it. So, let's say, for example, nag-aaway na yung family, wala nang pangtustos dun sa drugs, yet the person or a drug user would still continue doing it despite its adverse effects. Aside from that, it can also interfere significantly to one's functioning such as occupational, so hindi na nakapasok, hindi na nakapag-concentrate sa work, social, so disrupted na, may conflict na dun sa social relationships, and other functioning, especially psychological, kasi hindi na makapag-isip ng maayos. Okay, so how can we know if someone is using drugs? Okay, of course, drug testing is the most reliable way of determining whether or not a person is using drugs. Of course, we don't want to make an assumption based on what we see, diba? So it's the most reliable way. However, there are certain emotional, behavioral, and cognitive changes that we can notice if someone is using drugs. Ano ba yung mga changes na yon? So, in terms of emotional, okay, may mga times na very erratic yung mood, minsan sobrang saya, diba? Yung parang as if on top of the world, walang problema, and then biglang down, biglang naging irritable, nagiging impatient, nagiging sad all of a sudden, no? Another thing would be cognitive changes. So, impaired na yung cognition niya. Okay, nagkakaroon na siya ng kumbaga nagiging manic, no? Nagkakaroon na ng loss of concentration, no? Kapag nag-wear off na yung effect ng drugs, ha? Pero kapag intoxicated siya ng drugs, no, yung focus niya very sharp. Pero pag nag-wear off na yun, biglang mag-iiba. Down na siya. Okay, and behavioral manifestations. So, especially for those chronic drug abusers, yung behavior nila talaga nag-change. So, minsan, yung mga na-notice ko sa mga patients namin before, sila yung palagi nanghihingi ng pera. Wala na silang pera. Manghihingi ng pera, tas gagawin nila lahat para lang makakuha ng pera. To a certain extent that if they cannot get money to sustain their drug use, magnanakaw yan sa parents, sa asawa. Maya-maya kapag di na sila binibigyan ng pera, magbebenta na yan ng mga appliances. So, minsan may mga nawawalang appliances sa bahay, no? Kasi binibenta to sustain drugs. Another remarkable or notable manifestation of someone using drugs is palaging gising. Hindi natutulog. Tapos gusto niya palagi may kinakalikot, palaging may ginagawa. So, bakit nga ba may mga tao na nagiging addict sa drugs, pero ba't may mga tao na hindi? Doon pumapasok yung genetics. So, according to neuroscience, genetic factors may affect how people experience certain drugs, okay, which partly can determine who or who will not become abusers. So, meaning if there's a history of drug use in the family, there's a chance that the family members can also be addicted to drugs. And that's what we call genetic vulnerability. Those people who experience traumatic experiences in the past, physical, sexual, or emotional abuse, these are correlated to drug use. So, ibig sabihin, mataas yung chance na kapag naka-experience ka ng abuse, pwede ka rin gumamit ng drugs. So, ang drugs ba nakaka-affect pa siya sa mental health? Okay. The answer is yes. It can affect our mental health because the drugs can alter the way we think, we feel, and the way we behave. So, paano ba natin matutulungan yung mga addict or yung mga substance abusers to stop using drugs? We play a crucial role in helping these people by reducing stigma, no? And seeing them seeing that they also have the ability to recover from their disease, strengthening their coping mechanism so they won't resort to drugs again, strengthening family relationships and social relationships, making them feel that they are not alone in this battle. And another thing siguro is we cannot, yung mga family members, dapat hindi rin tayo maging enabler. Enabler in a sense na parang kapag nanghingi ng pera, halimbawa, bibigyan ng palagi. Kapag minanipulate ka na, pag di mo ako binigyan ng pera, lalayas ako. So, ibibigay na agad yung gusto. So, we have to be firm as well. Okay? And it's very important that they complete their rehabilitation program. So, if they have to be rehabilitated for 12 months, then we have to stick with it. Okay? And also, relapse prevention program is also important to prevent them from going back to drugs. Ano nga ba yung depression? Depression is a mood disorder characterized by feelings of worthlessness, feelings of hopelessness towards the future, extreme sadness, guilt feelings, and significant impairment in one's functioning. Okay, so sometimes it's also accompanied by suicide or self-harming behavior. So ano nga ba yung difference ng depression and sadness? Sadness is a normal emotion. We get sad every time we experience negative events. You failed in your exam, you feel sad. You broke up with your boyfriend or with your girlfriend, you feel sad. Pero, yung sadness na yun, it doesn't cause impairment in your functioning. So meaning, you can still study, you can still focus on your study, you can still meet with your friends. Unlike with depression, nagiging socially impaired na, or the person tends to isolate herself or himself from people around him. Na ang depression daw, para ka daw nasa hole na malalim. And you can't get up. All you can see is darkness. The commonly used treatment for depression is antidepressants. Okay, meron din tayong treatment such as transcranial magnetic stimulation, although very rare siya sa Philippines. Very few hospitals pa lang ata ang meron nun sa Philippines. Then we also have neurofeedback. So these are more on neurobiological approach kasi in treatment, which targets the brain chemistry. So more on normalizing the chemical imbalances in the brain. So yun yung work niya. So may mga technologies na pwede natin gamitin to scan the brain to check whether a person is depressed or not. Pero since these technologies are very expensive, why would use those technologies if you can use an assessment or you can easily assess someone with depression? In fact, yung mga psychiatrists, gumagamit na lang sila ng mga screening tool, yung mga patient health questionnaire. Kaya naman for psychologists, Beck depression scale or Beck depression indicator para ma-measure if someone is depressed. So may mga psychological tools din tayo. Pero it's very obvious kasi if someone is depressed, kitang-kita mo talaga eh. Hindi siya yung normal sadness lang. So may kita mo talaga if the person is depressed. So normally mga technologies na yan, yung mga EEG, PET scan, MRI, those are just for confirmatory and for research purpose lang. But to diagnose someone with depression, that's very expensive. So I don't think someone would spend a lot of money just to use those technologies. Pero meron tayong mga innovative technology that's being used, such as yung finger scan or fingerprint scan and yung mouth swab. So yung mouth swab, so kumukuha siya ng sample ng saliva dun sa person para makita kung merong molecule ng drugs dun sa saliva. And yung fingerprint scan naman, or fingerprint testing naman, kumukuha naman siya ng sweat dun sa finger ng isang tao to determine whether a person has actually used drugs.
Even as AMBians are susceptible to drug abuse and mental health problems. Every day, there are a lot of problems that come in our way. Some are probably troubled by family problems. Most of us are probably very much concerned about our academic standing. There are a lot of failures and obstacles that come in our way, but we must not let it close the door of opportunities to all of us. Are you okay?
Are you okay?
Are you okay?
A repetition. A cycle.
An addiction.
Because it seems that easy to hide and mask the pain.
For everyone's relief.
For the temporary fix.
Temporary entertainment.
Breathe.
Stop. This has to stop. We have to be the hope that they need when little seems to be left of it, or even none at all.
Because depression is silent.
Depression is like shaking up a bottle until it fizzes up and explodes.
Keeping it in at first until you can't take it anymore. Composure at its finest until it loses itself. Slowly.
And when depression hits hard, it hits hard. It goes down to zoning out, to vices, to drugs. Because the thought of reality seems to be hazier than the illusion of it.
Breathe.
That's why talk to them more.
Understand them more.
Be patient more.
Show your love more.
Text them, call them, have lunch with them.
Check up on them. Good days or bad. Listen to them, because their thoughts tend to consume them. Help them seek for help. Professional help. Psychologists. Rehabs. But do not make them feel sorry for their situation.
They need you to be their strength.
They need you to be the rock that uplifts, not the rock that drowns.
That suffocates them.
Breathe.
Be the rope that they cling on to. Sturdier and stronger than their grip.
It has to start with you. Prevent it before it gets worse.
Love yourself more.
Give yourself reasons to find happiness, because you are worth it. Allow yourself to feel. Open up to your emotions, but do not dwell. You know what's up. You're sad. Accept it, but do something about it. Allow yourself to
Breathe.
Move forward, step by step, because it is mind over matter. Surround yourself with positivity.
Prayer.
Don't let the pressure of society silence you. You've had your share. Know that you are heard.
Breathe.
Know that you